presented by Dr. Jesse, as I can see.
Good morning, Mr. Chairman, Co-Chairman. I'm Shamsodini, present this, and thank you very much for giving us this opportunity on presenting our data in this meeting. As we know that from the literature, that the replacement therapy of testosterone in hypogonadal patient has got a positive effect on a microscopic structure of the penis. So what we were interested is the effect of the testosterone. We have measured it with a RIGI scan in our case. So the objective was to assess the effect of the testosterone therapy, especially the injectable type, on the penile erection in a hypogonadal patient with erectile dysfunction. So this study actually is still going on, and so far we had subject. Their total testosterone were below 12 nanomole per liter. All of them with erectile dysfunction, and they went through the RIGI scan control at the baseline, and after 3 months, and after 6 months of the treatment of the injectable testosterone. Our baseline monitoring was included the medical history, a physical examination, we checked the comorbidities and the concomitant medication, and the patient erection was measured by IAF questionnaire. All our cases went with digital rectal examination, PSA, and total testosterone was investigated, plus liver function test and CBC and lipid profile. Our exclusion criteria in this study was the patient with high PSA more than 4, an abnormal digital rectal examination, or abnormal liver function test. Or our patient went through an education of how to use the RIGI scan. All the RIGI scan study was done at home, so we were showing them with video demonstration, and then they were taking this RIGI scan at home and they were using it. Then we were downloading the data in our computer. So what we were analyzing is the number of erection events and the average event rigidity, both in tip and the base, and the baseline circumference in centimeter, and the average event tumescence both in tip and the base. So this is the RIGI scan, or the RIGI scan that we have. Usually we taking the privacy of the patient, so he's receiving in the box like this. So this is the tip and the base that he's putting, and he's using it for 3 consecutive nights at home. So about our result, the correction that's happening each night, and 7 to also we have found an increased number of the average event rigidity in the tip from 56% to 74%, and also in the base from 48% to 68%. We did not find any alteration in follow-up of the liver function test, PSA, or digital rectal examination, or CBC. All of our cases almost had an improvement of their lipid parameter. And in this slide, ladies and gentlemen, you can see the number of event nocturnal erection at the baseline and after the 3 months of the injection, and you can see the obvious difference in almost all our patients. This slide is showing the improvement of average event rigidity, and again in the baseline of less than 60 to almost 70, more than 75% in the tip, and also on the base as well, you can see the significant difference improvement of average event rigidity. Our patient also, in this slide, you can see the difference between the average rigidity in the baseline, both in the tip and the base, at the baseline time and after the treatment. So in conclusion, ladies and gentlemen, the testosterone therapy with testosterone injection type in hypogonadal patient with erectile dysfunction significantly improved the penile rigidity and the event of the nocturnal penile tumescence within the 3 months. Those that allow the quantifying the erectile quality in this cohort study. Thank you very much.
Thank you very much. You said that these were erectile dysfunction patients and were treated with testosterone and they improved their nocturnal erection. There's any improvement in their erectile function during sexual activity?
Yes, thank you very much for this question. Our patients also, not only they went through the region scan, they went through the IEF scoring as well after the 3 months and 6 months. And unfortunately, I didn't put it in this slide, but they had an improvement in the IEF score as well.
So you're suggesting that treatment with testosterone is a treatment for erectile dysfunction in patients with hypogonadism, and this is can be the only treatment for them?
Actually, our patients that they were included, they were taking phosphodiesterase inhibitors, and most of these cases were not responded with the phosphodiesterase inhibitors.
So and they improved.
And then we have added the testosterone, and they had a better erection.
Thank you. Question?
I noticed you didn't have a control group for this. I think it's very important for drawing this conclusion. This is a very good pilot study, but to draw this conclusion, you need a control group because the improvement in the nocturnal erections could be lead to many other factors, like the patient under therapy, going through a better or more healthy lifestyle. Even they might be more experienced in putting on the registry scan on the second attempt. So I think this conclusion is not justified without having the control.
Thank you very much for this question. Actually, this is we had 11 cases so far, and still going on. It's a very good suggestion. Thank you very much.
There's another question.
Yes.
So do you tell us what the testosterone levels were during treatment? Did you report that? I didn't see that during your discussion.
Yes, our cutoff testosterone was either low testosterone or low normal testosterone. Here in these cases,
what were the levels during treatment when you were obtaining the second registry? You didn't tell us what the levels were, testosterone.
sorry, after the treatment,
Right.
yes, after the treatment, most of them improved, but we didn't put it in this study. Our aim of this study actually was to measure the registry difference between the baseline and 3 months and 6 months.
No, but it's a good question because you have to demonstrate there is a correlation between the increase in testosterone and the improvement in the nocturnal erections. You know,
Yes.
that correlation maybe is due to another thing. So thank you very much.
Thank you very much.
Very interesting study.